Hi, everyone. Welcome to today's webinar. This is webinar 2 in our Stay Connected weekly webinar series here at Aruba, a Hewlett-Packard Enterprise company. Glad you could join us today. My name's Anthony. I manage the webinar program and certainly appreciate you taking the time to join us for today's topic. This is part of our webinar series. It used to be a bi-weekly series, but this has been a little bit of a change for us. We're offering these weekly webinars covering a variety of topics to do with business continuity. It's a tough time for businesses, obviously, right now, and we wanted to address some of those difficulties you might be facing. And today, we are excited to be joined by one of my favorite presenters, and you'll see why in a bit, Samuel Hill. He's our Senior Manager of Healthcare here at Aruba Networks, to discuss today's topic, Simplicity in Chaos, how healthcare network operations meet new challenges. We were able to kick things off last week with how your network can deliver business continuity to you and your employees during these challenging times. We had one of our best attended webinars in the 2 or 3 years I've been running this program. So if you were on last week, thank you. For those of you who are joining for the first time and using the BrightTalk webinar platform, which is the webinar platform we use for the first time, I have a couple of notes, to share with you regarding the platform and how we typically do these webinars. First of all, if you're using it for the first time, BrightTalk, there's going to be a box underneath the slide window. There is to ask and submit questions. Please ask those questions throughout the webinar. We'll save them for the end. Sometimes in our past webinars, we've answered them during the webinar. We're going to save these to the end and address them in the order in which they came. If we don't get to all the questions, we do follow up with you directly using that email address you used to register. So fear not, we will get the answers to the questions. This is going to be a mix. There is some technical aspects to this presentation Samuel will share with you in just a minute. And there are some here are some of the things you're likely facing, just so we can make that connection and show you that Samuel does have the experience to identify with some of those things as well. So that's the type of presentation we have for you. Feedback at the end. We've modified our webinar series over the past couple of years due to the feedback of our attendees. You might say, well, of course you would. Well, we've actually taken it pretty serious and have modified these webinars down to 35 to 40 minutes max with the way we're delivering the presentation and the questions and answers portion. We do appreciate your feedback at the end. You'll be prompted to give some feedback, a rating on 1 to 5 stars, and any thoughts you had on the webinar. Don't be bashful. Give us your pros and your cons, and we will look to make some changes as well. There are some attachments and links that you'll notice, and we will also have a poll, which is something we haven't done in the past, but we're going to do that today. And so that's kind of the notes. So let's go ahead and get started. I'm going to hand it over to Samuel Hill. He's our Senior Manager of Healthcare here at Aruba Networks. And Samuel, go ahead and get started. Thank you.
Hey, thank you very much. Hey, good morning, good afternoon, or good evening to everyone. My name is Samuel Hill, and like was told, I'm the Senior Manager for Healthcare with Aruba Networks. And, most healthcare struggles sometimes to deliver secure, reliable, and on-demand connectivity. And so Aruba is really working hard to create a platform to help enable the type of experiences that patients, providers, and those that deliver the service expect from their network. And we've seen this really happening lately as the world grapples with the coronavirus pandemic. There's been so much happening within healthcare, so many changes, so much that has been challenging to different systems all over the world. As we can see, the virus has impacted almost every nation on the earth, and also really specifically now the United States with the largest number of tested and confirmed patients. And, there's just a lot happening. And so we wanted to take a few minutes today to chat about, how Aruba can help in some of these ways. We cannot solve the testing issues. We cannot solve a vaccine or anything for the coronavirus, but we can help deliver service within technology. And so we wanted to discuss just a couple of different ways that we propose to help you. But before I do that, I wanted to share a little bit about my background. I spent 7 years working as an emergency room technician at a couple of different health systems on the West Coast of the United States. And you name it, we saw it, we did it. And for those that are working on the front lines of healthcare, I'm just so grateful for all the hard work, the long hours in challenging conditions that are being faced right now by the doctors, nurses, care staff, respiratory therapists, care techs, x-rays, ultrasound, you name the pharmacists, the people that are just really giving over and above beyond what has ever been expected of them as our world grapples with this pandemic. You know, we've never seen a pandemic like this during the digital way of delivering healthcare. And so we're having to rapidly address problems that we've never seen before, challenges that we've never experienced. And so one of the times I wanted to tell you an ER story this morning to kick us off. And it's not, we're going to keep it probably PG rated. We're not going to go to a higher rating. We're going to keep it fairly family friendly. As you can imagine, some ER stories are less family friendly than others, but this one is fairly family friendly. So one day, this was told to me by a friend of mine. This did not happen to me. I want to be very clear about that. This happened to a friend of mine that I worked with. He relayed this story to me. So chaos is a reality in the emergency department. It happens every day, almost all day, 24/7. There is something chaotic happening. Even the normal things that, patients come in with relatively, I'll use air quotes, normal complaints. That's still a chaotic time in that person's life with their family. They're facing a challenge they've never experienced before. And that's why we have highly trained professionals in emergency departments to handle these type of situations. One of the most urgent situations, as you can imagine, is cardiac arrest, when the care teams are providing cardiopulmonary resuscitation, CPR, and really doing everything possible to sustain and save the life of this patient. Now, this happens a lot of times also in the first responders world as well, in the paramedicine field. So here's the story. My friends, they get a phone call in the emergency room that says the ambulance is bringing in a patient that's in a full code. They're performing CPR in the ambulance. They're bringing them in. And so the emergency room staff begins to assemble the care team to provide the expert care necessary to try and save this patient's life. So the ambulance pulls into the ambulance parking bay, and my friend, who's a patient care tech, walks out to meet the ambulance and to begin helping get this patient from the ambulance into the hospital. A little bit of a backstory here. If you're ever faced with a life-threatening challenge, you want a team of professionals that have done this before. You want a paramedic that has seen about 3 decades worth of medicine and has just treated and transported about every type of patient. You want them to have experience. You want them to know what they're doing. And that was the paramedic that was in the back of this ambulance. This paramedic had been practicing for 20 years plus and really knew their stuff. And so my friend opens the back of this ambulance, looks inside, and is ready to help. He's ready to go. And this paramedic looks at him and says, "I need you to run inside and get me a fallopian tube." Now, the problem with this is that in a hospital, there are so many tubes, and every single one of them has a name that it is likely that you've never heard of it before. And it's a common occurrence as a patient care tech that a doctor or a nurse or a paramedic or somebody looks at you and says, "I need this whatchamacallit device that you may have never heard of before, and you got to now go find it, figure it out, and bring it and deliver it." So that's what happened to my friend. He opens the back of the ambulance and says, and here's from the paramedic, "I need a fallopian tube." And for those of you in the back, if you don't know what a fallopian tube, I encourage you to go ask your mom. So my friend then runs inside and starts looking for a fallopian tube, and you can imagine the chaos that ensued. And fortunately, they got the patient inside and began delivering the life-saving care that was necessary. But doesn't it feel like that sometimes, that right now we've been thrown this massive curveball in our world as care technologists providing the services necessary for these frontline workers to deliver the care needed to battle the coronavirus pandemic? We've been thrown a curveball. And so I want to help us focus on a couple of different ways that we think value can be brought from technologists to the frontline healthcare workers, but also to the communities at large. And really, this problem is not going to go away on its own. It's going to require all of us to kind of band together, as we're already seeing communities all over the world taking radical steps to care for their elders and their neighbors. hospital environments really doing over and above work beyond what they've ever been asked to do before. You see, the progress on problems is really the measure of leadership, and leaders mobilize people to face problems. This is from a gentleman named Ronald Heifetz. He's a Harvard leadership theorist, and he's a student and teacher, again, at Harvard University, the John F. Kennedy School of Government at Harvard. He wrote a book called Leadership Without Easy Answers. And I put a link to that in the links section here on the Bright Talk platform. You can go look at that and download it or buy his book. It's a fantastic read. The book is Leadership Without Easy Answers. And that's what we're facing right now. And so really, as we look at how healthcare is rallying to the charge, rallying to the problem, we want to start measuring our progress. That's the measurement of leadership. And as healthcare technologists, we need to provide leadership to those on the front lines. You know, a lot of times these doctors, nurses, and care staff, they show up to work and they just expect their technology to work. They're not sitting there thinking about, hey, how do I extend wireless out to that parking lot? Or how am I going to enable a secure work from home? They're not thinking about these problems. They're thinking about, well, what type of patients am I going to see today? What's the treatment protocols for a patient that presents with coronavirus? You know, we think about those things. Our job as technologists is to think about those things. And I wanted to pause right now and acknowledge the number of people who are on this webinar today that currently work in healthcare technology. Thank you. Thank you for your hard work. Thank you for the dedication to supporting those that are supporting our communities. And thank you for just the wonderful stories that we're hearing from so many systems of rapid things happening that are really kind of outside the normal form of operations, and you're really responding to the cause. So thank you for making progress on these problems. It's really an honor to be a part of this community. I wanted to chat, though, briefly with you about the kind of three problems that we're seeing that Aruba can help with. We cannot help with everything. We can't go create a specific code in your EMR to order the COVID-19 screening test. We can't do that for you. But what we can do are help with these kind of three areas. And I'm going to run through them really quick. We've actually put a poll in our side over here. I'm going to make it live right now. And I want you to go and vote and say which of these are the biggest challenges that you're experiencing right now in your health system. What's the thing? The first one is the fear of the impending surge, which, as we've been given guidance by the CDC and the World Health Organization, we need to stay at home so we can flatten the curve. And the whole goal of that is to slow down potentially overwhelming surge to our healthcare environments. We want to keep critical patients able to be cared for within critical beds. We don't want to have hospitals being overrun by these patients that are either seeking testing or haven't tested positive, and we got to make sure we space out the resources. So that fear of an impending surge is a big problem. The other piece is the lack of space and supplies. There's a story, actually, I saw it on LinkedIn the other day, where the company that manufactures the uniforms for Major League Baseball, obviously Major League Baseball right now in the United States is not playing baseball games. So this company transitioned their manufacturing for it from baseball uniforms to hospital gowns and protective equipment and masks. Obviously, there's a shortage of that. You know, there's a whole issue with people that are wanting, that need, masks, gowns, personal protective equipment. But additionally to that, there's also a lack of space. You know, that we want to, in some ways, take triage from the emergency room entrance, maybe push it out to the parking lot a little bit, maybe have it to another space. Maybe we need to take over additional buildings or additional spots. Seeing some great votes come in. We're seeing some people that have voted. If you've not voted yet, please go over to the poll that we posted in the Bright Talk platform and make sure you cast your vote. And then the final piece that Aruba can help with is the reality that most healthcare traditionally works on site. Even folks that are non-clinical care. These might be people that work in a business office, they're in marketing, perhaps they're in IT even, or they have a function within the health system, but it's not related to caring for patients on the front lines. These people traditionally, even the non-clinical people, traditionally report to a hospital campus, whether it's an office building on campus or to the hospital itself. And these folks have now been asked to work from home. And so how do we enable them to work from home in a secure and really convenient way? So currently right now, looking at the votes live, I'm going to leave this poll up for just a few minutes, and we're going to start talking about some of the ways that Aruba solves or can provide value to these challenges and help you make progress on them. Right now, the fear of impending surge is the largest vote getter, about 50% of the votes coming in there. And then the lack of supplies and space coming in second at 25%. So again, please cast your votes. We'd love to make sure that we're reflecting and honestly understanding. This is a great way for us to understand the world that you guys are living in. So of the first challenge that we can help with, it's the fear of the impending surge. And so there are kind of two main ways that we've thought about doing this. And one of them is we want to extend remote testing and triage. We want to help you get care to either a temporary constructed place or to an off-site location. How are we going to do that? And so thinking about it, we have the hospital itself, and then we have maybe an off-site care facility. It could be a parking lot on campus. It could be a field near where I live. I live in the Seattle, Washington area. The city of Shoreline near Seattle actually commandeered a local soccer field and converted it into medical, basically medical field tents. And so how would we extend coverage to an area like that? So Aruba has been deploying outdoor access points for a very long time. This is not a new idea or a new solution, but realistically, it's fairly simplistic. Deploy an outdoor access point to extend the hospital's network. And there's a couple different ways you can run cabling and provide security there. Additionally, Aruba announced in response to the coronavirus pandemic that we've made a donation to the healthcare sector of about $50 million, where we are donating these healthcare connectivity bundles. So if you have need to rapidly stand a place like this up, I've included a link in our attachments here in the links. You can click on that link for the healthcare connectivity bundle and identify yourself. We're making this donation. Again, it's a donation. We're not asking for this equipment back. We're including the support for it for a term, and it's yours to keep. Another way, if you need a larger space covered, we just add more access points to cover the space so they can all mesh together. Now you can see the critical point of connectivity is from that outdoor access point. I've got it kind of reflected there. Maybe it's on a light pole or a power pole or something like that, something high up, connecting in over Ethernet between sites. If you're not able to connect over Ethernet, we've been deploying these type of solutions in some of the most complex and difficult environments that you could possibly imagine, from hurricanes to earthquakes and other natural disasters to, we're seeing the pandemic become something that's really stretched and grown the capacity of within healthcare. Whether you need a satellite backhaul to go over cellular, if we need to mesh a series of these outdoor access points together, or if you need to do point-to-point microwave, Aruba has the expertise to help you make sure that this expansion of space can help you process the surge in patients coming into your environment. The other way that we can expand coverage for the fear of impending surge is the lack of space. The lack of space and supplies is we would offer that, right now, the hotel industry is struggling. There's been an unprecedented drop in hotel room bookings, and also all of our local colleges and universities have told their students to return home. So you have a lot of dormitories open. Might make sense in some environments to extend a healthcare network to these vacant rooms for non-critical patients to recover and get back to health or become non-contagious during that time. Aruba does this very simply in a way where we use what we call our SD branch. And the Aruba SD branch is a cloud service that enables SD-WAN and SD-LAN capabilities, and we combine it together. We call it SD branch. So you can have multiple points of ingress and egress, and you can have all of the traffic shaping, quality of service, and dynamic path selection that you would expect from Aruba. And in order to make it really simple to do, you deploy what we call a branch gateway at the site, whether it's a university dormitory or a vacant hotel. And then you can plug in with some significant engineering work. We're not just plugging things in and it just works magically. We have to actually do the work, but Aruba is standing by to help with this work. You can run an existing hospital network using SD branch into an existing layer 1 through layer 3 of a hotel or a dormitory. So that removes the need to go run new cable or hang new access points or stand up new switches to get that site operational. It can be quickly and conveniently done. In order to help with some of this work, Aruba also announced what we call our Airheads Volunteer Corps. In the Airheads Volunteer Corps, we have close to 400, so hundreds of Airheads around the world. Airheads is the user community for Aruba Networks. And these Airheads have volunteered their time to help support healthcare companies and agencies all over the world that need help. And so if you are facing either a resource shortage from a staff perspective or a knowledge shortage of, hey, we've never done something like SD branch to an unused hotel, well, maybe the Airheads Volunteer Corps hasn't either, but we at least have other experts that are there willing and ready to help. Again, this is a donation. If you would like to click on the link to learn more about how you can volunteer to become an Airheads Volunteer Corps, or if you need support from the Airheads Volunteer Corps, we stand ready to help make sure this is delivered for you in a way that is going to be beneficial. And now looking at our poll really quick, just a quick check-in on it, looking like the lack of supplies and space is actually currently the lead on the votes for which of the challenges healthcare is seeing right now. Thank you for all the votes that have come in so far. Still, we'll leave it open for a little bit longer while we talk through some of this. Please feel free to cast your vote and make sure that we understand what is happening. The last problem that Aruba proposes an offer to help with is for those that traditionally work on site. How can we help them now work from home? Aruba has been doing work from home for a long time, really since the H1N1 swine flu pandemic in about 2008, 2009. We really went live with a product offering that enables work from home in a really secure way. And we've been really helping companies, large and small, deploy remote work teams for a very, very long time. So this is not a new system, not a new solution for us. We've been doing this for a long time. And in fact, Aruba has been doing this internally for quite some time. Myself personally, I work remote primarily. We don't have an office locally to where I live that I go into. And I've actually spent more time in the last 3 years in our corporate headquarters down in Santa Clara than I have in the office that is local to me here. It's really not, it's just a normal part of life for us. We work from home. And so we've learned a lot of tips and tricks about how to do this. And there are kind of a couple different ways that we would deploy work from home solutions, kind of depending on the user and what they need. If they're a non-clinical staff, they're going to have different needs than clinical staff. And so we have a couple different ways to address that. For non-clinical staff, one of the easiest ways to do that would be to install what's called our virtual intranet access agent. This VIA agent sits on the device, whether it's a phone or a machine or whatever it is, and it then creates a secure tunnel back to the healthcare network. And this is ideal for maybe the business analyst or the finance person or somebody in marketing or you name it that works in a hospital environment that's now been told to shelter in place at home and is still wanting to remain at work. We need to enable them to access the secure applications in the hospital network without a cumbersome methodology for them to connect or have difficult structures to set up a VPN and do all those things. So the virtual intranet access agent is a really great way to help those workers work from home. A second way that we've been helping, this is really great for those doctors and care providers, whether a nurse practitioner, physician assistant, or other care providers that are needing to provide in person or over video consultations with patients. We deploy what's called a remote access point. And this is a great way, what it does is actually creates a secure tunnel back to the healthcare network and then broadcasts the existing healthcare ID, wireless SSID that they expect in the hospital. So what it means is that this doctor takes their laptop home and they open up their laptop and they connect to the same hospital network in their house as they would if they were on campus. And this is very useful. I know we've seen a lessening of the restrictions for telemedicine, and I hope that we have a thoughtful conversation on telemedicine going into the future after this pandemic has run its course, and we can begin to deliver more care to more people in really unique ways. And I think virtual and telemedicine and telehealth are going to be really critical ways to do that. Aruba has been enabling care providers to deliver this care using our remote access points. You can kind of see it on the screen. There's one on the left side. It's a remote access point that's got a desktop stand on it. And this remote access point, this form factor has some ports that you could also plug in a hard phone if you needed to. You could plug in a printer if you needed to. It has some ability to deploy fixed Ethernet ports, and it's very simple. The person takes it home, they plug it into power, they run an Ethernet cable from the identified port on the bottom of that access point, and they plug it into their existing internet router. And then they have, after a configuration setup, the hospital network will then be broadcasting in their environment. Now the hospital network is secure, so not everyone's going to be jumping on that hospital network to stream Netflix or whatever else they're doing in the home. Additionally, the remote access point is smart enough to know, hey, this traffic needs to go back to the hospital. This is secure, privileged traffic. we need to encapsulate this in our VPN tunnel and send it back to the main office. It's also smart enough to know, hey, this traffic is meant for the local internet, whether they're going on Google or social media or something else. That's local internet traffic. It's smart enough to drop it off locally at the internet service provider at the house. So instead of sending all that traffic back to the main hospital as well and then back out to the local internet, the VPN tunnel is smart enough to understand, oh, this is local traffic. We're sending it straight out to the internet from here. Additionally, every single Aruba access point can be configured to become a remote access point. And that's a very useful thing because, you know, now you don't have to wait for stock or availability or a specific form factor. We can get you any Aruba access point and you can get your people delivering care working from home. Thirdly, if you have a situation in which you need more than a couple of access points, we can deploy what's called an instant access point VPN cluster. And this cluster, you deploy the access points, they come online, they receive their DHCP, they boot up, and then those access points will elect one of the swarm to be the master, and then the master will then create a secure VPN tunnel back to what we call a VPN concentrator. All of these create an IPsec VPN tunnel back to your VPN concentrator. And that's the industry standard, very secure way of creating these VPN tunnels. And Aruba has been doing this, like I said, since 2008, 2007, that time frame. We've been doing this for a very long time. Today, we have two ways that you can deploy a VPN concentrator. The first way is with an actual physical box that sits inside your hospital's DMZ, your demilitarized zone, next to your firewall and next to your outbound internet. And this then receives all of the VPN tunnels from all of the different forms. And you can do a mix of it. They don't all have to be remote access points. They don't all have to be via agents. They can be a whole mix. And it's just a matter of sizing the number of tunnels that VPN concentrator will need to terminate. So that's one way. That box can sit in your DMZ, and it does a fantastic job. The other way is if we can do what's called a virtual gateway. And this virtual gateway will reside in either AWS or Azure. And so should you have workloads that are specific to AWS or Azure, this is a very seamless way for users to get access to those applications that are there. And you can deploy very quickly and very simply a VPN concentrator in AWS or Azure. And finally, I'm going to close my comments with some real generic thoughts, but very, very, very pointedly, we want to thank you, all of you that are in healthcare, that are working so diligently to make sure that our providers are meeting the needs of our communities. I've been seeing some very encouraging statistics. Like recently, both state of California and the state of Washington announced that they were sending back ventilators to the national pool. We're starting to see, from the modeling done by the University of Washington, my state and the state of Washington, we saw the peak resource usage earlier this week. So we're starting on the downslope, theoretically and hopefully. And so hopefully the end is in sight, and hopefully we can all begin the process of figuring out what normal looks like. But as that process works out, there's going to be many challenges, and a lot of people are going to have to figure out new ways to do things. So our hope is that you can trust Aruba to be that partner to stay with you. We want to stand right next to you as we solve these challenges together, and we are committed to doing whatever is necessary to make sure that our communities are cared for. So with that, stay safe, stay connected, and I would love to hear from you. My email right there on the screen, shill@hpe.com. Thank you for your time.
Hey, Samuel, we have a couple of questions before people
Fantastic.
leave. Hopefully, yeah, can you hear me all right?
I can, yes.
All right, perfect. Here's the first one. Can you share, or do you have any examples of healthcare deployments for COVID-19? Example, this is in parentheses, what are other healthcare organizations doing?
Yeah, I mean, I've seen some of our customers specifically, like they sent their construction crews to just add on a temporary entrance, if you will, to kind of keep it separate from the hospital. So that was a pretty unique use case. Central Park deployed a bunch of military field style hospitals. And then the rapid rise of video conferencing has actually been really interesting to see as well. Again, I really applaud the lessening of the telemedicine restrictions, so that way that people can actually continue to visit with their care providers. I mean, one of the challenges is that, people that have chronic medical conditions still need care. not all the patients in the hospital are coronavirus or COVID positive patients. So we still need to provide care. So there's been a lot of interesting use cases. We've also seen really interesting things where this isn't a healthcare use case, but you can maybe see the corollary, like educational institutions or city governments are putting a bunch of remote access points into a bus and driving that bus to places where they need to provide connectivity. So this would be a way for a medical institution to be able to provide some service to maybe underserved communities or those that have, some negative social determinants of health, people that can really benefit from it. So those are some of the things that we're seeing healthcare do right now.
Perfect. Here's one. Samuel, what experience does Aruba have into hospital premises talking about diagnostics image transmission?
Yeah,
I don't think I'm reading that right. I think, yeah, go ahead.
I'm gonna make a couple of assumptions here. I'm assuming we're talking about like maybe radiology images, like an X-ray or an MRI, CT scan. That's what I'm assuming the question is going after. So I'll comment on that. The ways that we would handle that is traffic can and should be prioritized. Not all traffic is created equal on the network, and Aruba has got an incredibly robust set of rules and abilities to prioritize traffic across our wired and wireless networks. We start with doing a role-based access to the network, and then it starts with if we can identify what kind of traffic this is and then apply the right levels of policy. Obviously, an image should get downloaded before a Netflix stream should be. So there are things there that we can definitely help with.
Samuel, are you saying that there are some healthcare workers that watch Netflix at the hospital or at their...
Oh, no, certainly not. No, well, actually on break maybe, but certainly not the patients, guests. Yeah.
There you go.
Yeah.
Yeah. Okay. Thanks for that question. And by the way, I'm not able to see the user ID or an email address of who asked the questions. So if that's not what you meant, please go ahead and ask another question or follow up and say, actually what I meant was X, Y, or Z, and we'll try and get you a more specific answer to your question, maybe after the webinar is over. But thank you for the question. Here's one, and we get this from time to time on our webinars, not just this series, but also over the last couple of years. How does Aruba interoperate with other network manufacturers?
Yeah, that's a great question. Transparently, Aruba we are not the largest player in network technology within healthcare. We interoperate and have to interoperate with the vast majority of those out there. And so the way that I answer that question is like this. We have a standards-based approach to constructing a network. And so if we can communicate in a standards-based way, we can interoperate with any other manufacturer. So whether that's attaching outdoor access points into a Cisco network, that can be done. Whether it's running Aruba switches with Cisco access points or another manufacturers, we can figure that out. Again, as long as we can all speak common industry standards. Perfect.
Thank you. And again, appreciate the questions. Continue to ask. We just have a few more, and then we'll go ahead and wrap things up. But if more questions come in, then we will try and answer them during the webinar. Here's one, and this person apologizes because they joined late. That's okay. No worries. Tell me more about Airheads Volunteer Corps and how do I sign up?
Yeah, absolutely. The Airheads Volunteer Corps is, honestly, I've been with Aruba for almost 4 years, and this is probably the most proud that I've been of our company is things like the Airheads Volunteer Corps. So the Airheads is the user group for Aruba Networks, and these are engineers, and they're people that have deployed or are operating Aruba systems in real-world environments. And Airheads are also Aruba experts from within our company, the product engineers, the research engineers, the support and development, those folks. They are really, really experts within networking. These aren't just random folks that are off the street. These are people that really understand what they're talking about. And we've really built a company on Airheads, people that are engineers and are tech-focused. And so the Airheads Volunteer Corps is people that have raised their hand to say, I will help. If you have a customer or a hospital system that is in need of my expertise, I will willingly donate it. And so if you want to get involved as an expert that's willing to donate their time, we have a link for that in our attachments. And if you can email me as well, if you have further questions, I'm happy to talk about it. But this is a way for you to say, I have spare cycles, I can give back, I can support healthcare in this time.
Perfect. Thanks for that one. And I do believe you probably just said that. I was reading some of the questions that just came in, Samuel, that in the attachments and links, there's a link in there to the Airheads volunteer course. So go ahead and check that out if you want more information on that. This one just came in, and we answer this one every time we do a webinar. And in this case, it's got the hospital or healthcare slant to it. But why Aruba wireless over Cisco Meraki for hospital or healthcare? And we normally get that question, Samuel, anyway, but in this case, why specifically for healthcare or hospitals?
You know, that's a fascinating question. I think traditionally the Cisco deployments that I see in healthcare are not Meraki. Meraki typically exists within a branch office, clinics, remote sites, that type of thing. And Meraki really made a big play into that market. They wanted to be easy, simple, cloud-based, and all that kind of stuff. And so the challenge that hospitals that deploy a Cisco solution, maybe they do Cisco, the AeroNets, and their main campus, and then Meraki for their clinics, is that they have two management platforms. In Aruba, every access point that we make can be managed in any of the varieties of ways that we offer management. So we offer a controller-based management. We offer the instant access point, kind of a swarm cluster-based management. And we also offer a cloud-based management. It's called Aruba Central. So we have a competitive offer to the Cisco Meraki Cloud. We call it Aruba Central. And it is highly reliable. I can think of 2 or 3 healthcare systems that I know personally that are currently using the Aruba Central platform to deliver value. And this is a platform that Aruba has invested very heavily in. We see the future is going cloud. And so the benefit that we have is, one, we provide, in my opinion, a superior wireless performance for controller-based access points over the Cisco AeroNets. And then also, we can then integrate, and we don't have to give you multiple management planes to manage the entirety of your health system and all of your use cases. You can do it very simply within Aruba Central and get the value out of the whole of your Aruba portfolio.
Perfect. And actually, Samuel, we just have one more we wanted to bring in here, and this is going to test my knowledge of acronyms in our industry. We get a lot of acronyms, but this one is, how is Aruba doing WFH for their people? Work from home, I believe.
Oh, yeah. Work from home. So Aruba is doing this. Again, we've been deploying work from home for a long time. And, and it's interesting to see kind of our culture. We did have a work on-site, work at the headquarters culture. If you've ever been to the Aruba headquarters in Santa Clara, you would understand. It's a fantastic building and place to work, and they did a fantastic job building that space out. But with the current reality, we're all working from home. And we have, support centers, research and development, all sorts of people all over the globe now required to work from home. And really, we made that shift very easily. So people get the remote access point, they go home, they're able to get access to their labs, their access to get to the research that they're doing, to the support structures. Our technical assistance center is online and operational without any hiccups. People are over. We did our best to eliminate the technology challenge, and really people are just having to adapt to the work style challenge of, hey, how do I set up my home office? Where am I most productive, and what things, how does my life function now? So we've really done a lot with our technology to make that very easy for people.
Yeah, and Samuel, I don't know about you, but my WFH setup is still a WIP, so it's still a work in progress. While you were answering that question, go ahead. Sorry.
I was going to say my wife encouraged me to make sure I locked the office door so that my children didn't come in. So my WFH is also WIP.
Yeah, I like to use copy paper to write webinar in progress, and then a sign. So no talking. But anyway, this one just came in, and I don't know, this is a little more on the technical side, but can you implement a remote access point at a remote location without the Aruba VPN concentrator? That's the first part of the question. And can you do it on a 6X or 8X within a mobility master or local master configuration? That sounds like somebody who is familiar with the technology.
Yeah, that's a fantastic question. The key part, I know you can do wrap termination in 6.x or 8.x. That software code is fine. The key question for me is the Aruba VPN concentrator. So I'm going to take that one offline and get an accurate answer.
Perfect.
Person with that question,
if
you can email me, shill@hpe.com.
Yeah, and also, Samuel, I can get we can go back in and look and see who asked that. It just doesn't show up on the screen during the webinar, so we can follow, between the two of us, we can figure out how to get that person their question answered.
Excellent.
All right. Hey, you know what? Thanks, Samuel. And then based on today's presentation, I'm pretty sure we're going to be asking you back to present on the webinar series in the future. Sorry about that. Well, we'll have our people contact your people, if that's okay.
That sounds great.
Perfect. Samuel Hill, Senior Manager Healthcare for us here at Aruba. This is the second in our weekly Stay Connected webinar series on business continuity. We invite you to visit the arubanetworks.com homepage. If you scroll down to the bottom and click on the webinars link in the menu at the bottom of the page, it will take you to the page to watch past webinars on demand or register to attend the future webinars. And that's going to do it. I really appreciate not only you, Samuel, I want to thank you for joining us today, but I want to thank everybody who attended. I know this is a difficult time. People are trying to get used to how things are now, but we really appreciate you. I know there's a lot of webinars out there, and we really appreciate you joining ours. We will follow up with those of you who ask questions after our Q&A session using the email address that you used to register for the Bright Talk webinar series. And that's going to conclude today's webinar. So until next time, please have a great day. Thanks.